right, we're sitting here with a lovely patient of mine. How far out are you now from your surgery?
Close to 6 months.
6 months, awesome. And how are you doing?
I'm doing great.
That's amazing. What procedures do you have?
I had a breast reduction and also a tummy tuck and some liposuction on my inner thighs.
And were you the most clean-cut case? Were you a simple case?
No, I was not a simple case at all.
She was a little troublemaker. You had multiple surgeries on your tummy, right?
Yes, I had open surgeries plus vertical surgeries for my kidneys when I was a child.
Uh-huh. And you're a nurse as well.
I am.
Not only are you a nurse, you're the dean of a nursing school.
I am in
A
Virginia.
very good one. Yeah.
Yes.
So she's a powerful woman. But the interesting thing is, what was the reason why you decided you wanted to have an abdominoplasty? Because it wasn't just cosmetic, right? It was functional as well.
It was functional, yes, and because I had a lot of abdominal weakness from multiple surgeries, including an open surgery. So we were actually correcting the abdominal wall and making sure there were no hernias, and so making sure they were corrected.
Right, and so and you've had hernia surgery in the past, right?
Corrected, yes.
And there's mesh in there.
Yes.
Yeah, so she had mesh in there also, but it was on the inner surface. And she also had muscle weakness. So the reason why we decided to do this is that obviously she wanted your tummy to look better, but also she really did it to get her core strength back.
That's right.
And we were able to. How does that feel now?
Oh, it feels wonderful. I feel much younger than I have as far as core strength. Yes.
Interesting. And then, do you feel like there's less back pain? What are some daily things that you notice that are different?
I feel stronger, and I actually feel like I have better posture as a result of that.
That's amazing. And one of the things too that happened with you is that we kind of found that you had some condition that we weren't aware of, where you kind of bleed a little bit more, but we found out after the fact, and you had some post-operative issues. That's always something that's scary about surgery, and this being in healthcare, but we were able to address that and take care of you. But can you just kind of give us a little bit of a synopsis so patients understand kind of the level of care that we have here?
Yeah, I think it was pretty amazing. Even though I had complications, that the nurses that were here, and I had elected to stay the night, which was my choice.
Right.
And I'm so grateful that I did, because I was with an ICU nurse all night long who knew exactly what to do and to make sure that she was contacting you throughout the evening. But the level of care that I received, and then knowing when the next steps needed to happen was critical. Yeah. And so I was able to get the care that I needed, and then I recovered very well.
Yeah, that's pretty remarkable. So we're super excited for you. It's so great to develop this relationship with you, and I'm impressed by all your success in the position that you're in now. So we appreciate it. We'll see you soon.
Okay, thank you so much.
You're welcome.
All right.